Common pathologies such as plantar fasciitis, posterior tibial tendonitis, or patellofemoral dysfunction are easily addressed by positioning the EXOS foot orthosis into an inverted position. Oftentimes the patients walk in with plantar fasciitis, and that's where they have excessive stress across the medial fascia band on that foot. And again, it's from repetitive torsion of that foot on that fascia band. And the correction for that is to place the foot in a position that would take the stress off the medial fascia band. Oftentimes, when a patient walks into my practice, what I see is a foot that looks like the shoe twisted, okay? And sometimes the shoes actually look like this too. And what you can see is, so the back of the foot is twisted on the front of the foot. This essentially puts tension across the internal band of the foot, called the plantar fascia band. Just like the shoe, the foot will go through that twisting motion. And as a clinician, what I want to do is take that foot and twist it back the other direction, all right? So when the patient's in front of me, I can see that that's what I wanted to do. If I could just take that foot and twist it back in the appropriate position, that's going to take the stress off that medial fascia band. For the majority of the patients, the problem usually lies in instability across the medial column of the foot, or the inside of the foot. That's going to put excessive load across these structures. And a classic example is the fascia band right here. So as the foot pronates, or the arch drops, it puts excessive stress across this medial band. So most of the time, if I want to do an adjustment on a foot orthosis, all I really want to do is take that foot and twist it to the inside. By doing so, it's going to invert the rear foot and take the stress off the medial column of the foot. What that means is I'm going to utilize the top quality shape that this orthosis already has, but I'm only going to adjust a very small portion of that foot orthosis. And to do this, I'm going to use a high temperature heat gun, and I'm only going to spot heat the inside portion of that foot orthosis, leaving the rest of it rigid. You can see it only takes a few minutes for this to get very supple. To post it, I'm going to use my hand and I'm going to position the rear foot so it's inverted, and then use my other hand to bring the medial column of the foot down to the ground. And again, that will increase the arch height, take the stressing off the medial fascia band. It took about 30 seconds to a minute to heat this up, and it takes about that long to go ahead and reposition the medial column of the foot. So you can see it's set now. The rear foot is inverted, and the stress will be taken off the medial fascia band when the patient steps on it and ambulates. So after you invert the rear foot on this device and bring the forefoot back down to the ground, you can see what holds that position is the anterior medial edge of the shell, or this point right here. That is what's going to stop that device from collapsing into pronation again. So with the patient's foot on there, that's what's going to stop the movement from occurring.